Paul, what is the situation regarding complaints in the HSE and NHS?
Well, the HSE in Ireland, they received 9,000 complaints in 2008. In the same year, in the NHS in the UK, there was 137,000 complaints. And pro rata, it's very similar. It's a very similar amount per head of population. And we tend to view complaints as a negative thing, but actually, if we really looked at complaints, we could take out the value of a complaint, because complaints can help you improve. If you systematically take a complaint and find out what's at the bottom of it, what the root cause of that complaint is, we can improve and redesign our healthcare systems.
So please describe what it is that Q-Zone does.
Well, what Q-Zone does, it can take thousands of complaints, or it can take ideas, wants and needs from maybe nurses and clinicians on the other side of the front line of what they need to improve their system at the front line, at the ground level. So what Q-Zone does, it takes all these ideas, these complaints, these experiences, and it clusters them into related groups. And that's where the crowd of people are thinking. Now, what that does is it prioritises where you need to look as a manager, as somebody that's involved in redesign. And within that cluster, you can then drill down to identify a problem, and you can drill down further and it will give you solutions and it will define that problem exactly. So Q-Zone basically is an analytical tool, but it analyses patient or healthcare worker stories, their experiences, and it presents the information to managers, to people that are making decisions to help support that decision-making process.
And who are your customers?
It's a new concept. We have trialled this with NHS in a SHIP, which is Southampton, Hampshire, Isle of Wight and Portsmouth, and we used it to redesign or to help them redesign the patient pathway for stroke. And specifically it was the early supported discharge section of that pathway. Now, we gathered 685 stories from clinicians, from patients, and we were able to present that in such a way as that it helped them make decisions on how to put the specification together for the contract.
Would that approach work in other countries too?
Well, I guess the thing is, if we don't understand what's going on at the front line, we can't improve it. And what this tool does, it will help anybody that needs to understand what's going on at the front line, at the grassroots, and it will help them support whatever they have to do. So if it's a strategic decision about what needs to happen, or whether it's redesign or improvement, or whether it's trying to improve outcomes, or improve efficiencies, it will help in any situation as long as we can have the stories. In lots of cases, many organisations are already collecting stories, but they're not using those stories in a systematic way to help improve healthcare. What Q-Zone can also do is first of all, it identifies what quality is, because as a patient, you know what your quality of your care has been. Now, if a lot of people are complaining about the same thing, that you will get a cluster of complaints around one specific quality or aspect of quality. So it will identify quality across a whole wide range of pathways and where that quality is failing. It will also identify risks. People will see risks and they will flag risks up. People think about risks all the time, and if we can collect the stories, their experience of risk and the potential of risk, we can present that as well. And where you've got a large number of people identifying the same risks, then that really becomes an area of priority.